If you've got a postnasal drip, are there any other ways to get rid of it except clearing your throat to remove mucus? That's a good question. We need to think about what is actually causing you to have a postnasal drip. There are some of the most common reasons would be allergic rhinitis, which is where you have allergies, which are irritating your nasal passageways, which cause you to develop excess mucus, which then tickles the back of your throat, gives you the postnasal drip. It could be, and that could be caused by things like hay fever, seasonal allergies, animals, pets, whatever, lots of different things. Another common reason would be something like sinusitis, usually caused by viruses. And again, that's just you get a buildup of mucus and inflammation within your nasal passageways and your sinuses, and they're all kind of interlinked anyway, and that can give you a postnasal drip. The third most common things is reflux, which is where stomach acid is coming up from your stomach, up your esophagus, tickling the back of your throat, giving you a postnasal drip. And then the fourth is doing really naughty things by snorting various substances through your nose, and that can cause problems with the back of your nasal passageway. So to treat these, first of all, stop shoving things up your nose. Second, if it's caused by reflux, then treat the reflux. There are lifestyle and medical things that we can do for that. If it's caused by rhinitis or sinusitis or hay fever or allergies or things like that, then first of all, do not ever use nasal decongestant sprays, but you can use saline sprays. You can do nasal saline rinses, and you can use nasal steroid sprays. Now, there is a very specific technique to using these, but one thing that I've started prescribing some of my patients where it's a bit harder to get rid of their symptoms is a nasal spray that contains both an antihistamine and a nasal steroid.